National Cabinet has agreed to tackle the growing cost of the National Disability Insurance Scheme. The Prime Minister has declared the massive increase in spending is unsustainable as the states also address growing hospital pressures.
A new face around the National Cabinet table.
I want to welcome Chris to his first meeting.
The New South Wales Premier joins the sea of Labor leaders across the nation, all united on the need to fix the country's healthcare crisis.
There's a huge GP shortage.
It's absolutely unbelievable, the demand. It's putting enormous pressure on our hospital system.
The fiscal fix will begin in the budget, with $2.2 billion to begin overhauling Medicare. Financial incentives will be given to GPs to keep their practices open after hours. Also, to lighten the load, nurses will do more primary care work and pharmacies will get involved in vaccine rollouts.
And these reforms are practical and will make a difference.
This is just a start, and as I said, we'll see what actually comes out in the budget.
National Cabinet will look at ways to boost housing supply. It will also work on a plan to improve the rights of renters.
It's up to states and territories. This is within their power.
For the first time, states have agreed to confront the ballooning cost of the National Disability Insurance Scheme.
The trajectory of NDIS expenditure is just not sustainable into the future.
Yearly growth in the scheme has blown out to 12 to 14%. Governments agreed to try and reduce that to 8% by 2026. When the NDIS was established, states agreed to share the cost 50-50, but they're no longer meeting that. This year, the Commonwealth will fork out 66%. That's projected to grow to over 80% in a decade.
Will we see cuts in services? What's the plan? The states won't come to the party.
We all have an interest in developing, making sure that the NDIS is sustainable going forward, and that's agreed.
The Prime Minister publicly reluctant to call on the states to do more, instead leaving it to his NDIS Minister Bill Shorten to make the case privately. The funding deal is due to be renegotiated by the end of the year.
And we work well with the states, and the states are doing a fair range of things.
It's understood states will be pressed to stop cost-shifting treatments onto the NDIS rather than return to the 50-50 funding model.
Everyone here is absolutely committed to the NDIS. We want to make sure that it actually can continue.
Confirming a shift in sentiment from Labor, who last term rejected the Coalition's concerns about the scheme's sustainability. Trudy McIntosh, Sky News, Canberra.